Hey guys, my name's Jeremy, and today I actually got bilateral laparoscopic inguinal hernia surgery done. Um, I'm actually a flight paramedic, and I actually had a little bit of an insight as to what was going to happen during the surgery, having worked in the operating room and doing things of that nature. However, I did a little bit of looking around on the internet, kind of trying to get an idea as to what I could expect after the surgery, and I found one video here on YouTube that was pretty helpful. However, I wanted to kind of post one of my own just to give people a little bit more information, so that way there was a little bit more information out there on the internet to kind of help those who are looking at having the same kind of surgery done. I went in this morning at about 9:30 this morning and got all my paperwork done, and obviously the obligatory questionnaires and all that nice happy stuff about your medical history and whatnot. Um, got that done, ended up going back to a room. The nurses came back in, more questions and whatnot. Got my IV started, which in and of itself is, for a lot of people is a big deal, but I do it every day, so I was kind of expecting, what was going to be going on. After that, got to talk with the surgeon and the anesthesiologist. And got walked back to the operating room. Got comfortable on the operating room table, and probably within about 2 or 3 minutes after I got done, laying down, I was out. Got the propofol, or as some people know it, the Michael Jackson sedation drug, and the stuff works great. If that's what they end up giving you, it works great. You don't remember anything about the surgery. The surgery took about an hour or so. I was made to believe, or made to find out by my wife later. They wheeled me back into the recovery room. I was in the recovery room for probably about 15-20 minutes, and I started to totally come around. I had not too long ago had a laparoscopic cholecystectomy, or gallbladder removal, from the same surgical center, and was kind of concerned that I was going to be in the same amount of pain that I was when I got my gallbladder surgery done. That wasn't even remotely the case when I came to. Um, I was actually quite comfortable once I was in the recovery room. Um, they did give me some fentanyl for pain and whatnot, and some Zofran for nausea, which both of them work really great. Once I was totally with it in the recovery room, they wheeled me into a little kind of holding room to finish, I guess, waking up the rest of the way. And once that was completed, I ended up getting dressed. The nurses came in and took my IV out, and basically my wife, drove me home. When I got home, and actually when I was at the surgical center, I actually felt good enough to walk to the restroom, walk from the wheelchair to the car, walked in the house. I feel sore, and obviously I am still on some pain medication, but I'm not totally stoned out of my mind. Um, I look like I'm about to fall asleep, sitting on this video, but it's just basically because of the way I'm sitting, and it's pretty bright in the window behind me, so I'm kind of squinting a little bit for that. I did get a prescription for Percocet, and I haven't had to take any of those yet. I would say my pain on a 0 to 10 scale is probably about a 3. It's nowhere near the pain that I experienced once I got my gallbladder done. And this kind of makes perfect sense. When you get your gallbladder done, they have to punch through quite a bit of abdominal muscle, and when you get a laparoscopic hernia surgery done, they actually don't punch through the muscle at all. They actually go behind the muscle, which really lessens the amount of pain and speeds the recovery time for you. I was told that I shouldn't be lifting any kind of weight, or over 10 pounds for about a month. I am going to go back to work this coming Wednesday, and I'm just going to be smart about it. You got to use a little bit of common sense. Don't do anything that's going to, tear anything loose. During the surgery, they did put in 2 pieces of Dacron mesh, to strengthen the areas. And I had some fairly large hernias. The one on the right side was almost 3 by 4 inches, and the one on the left side was almost 1.5 by 2 inches. That's fairly good size. But I just want to let everybody know, that the surgery is minimally invasive. If you get the laparoscopic version done, you'll feel pretty decent once you get the surgery done. Come home, do like I am right now, lay on the couch and just kind of relax, play some Xbox, play some PlayStation 3, watch television, whatever you want to do, and just relax. I'm going to probably post another video tomorrow, because the video that I watched on YouTube to begin with said that the guy was in a little bit more pain the next day. Believe it or not, I'm actually planning on going camping tomorrow with my wife. So we're gonna see how things go. Hopefully, I can get a good night's rest tonight, get a little bit of a nap today, and feel much better. And I hope this is kind of a good idea or good informational video for you guys. And I'm gonna post, like I said, post another one tomorrow to let everybody know how day 2 is. And I hope you guys find this educational. Have a good day.